Well, today we're back talking to Dr. Sonia Spencer about different things that Spencer Chiropractic and chiropractic medicine can do to help you. How are you? Good to see you.
I'm doing great. It's so good to see you, Jim.
Well,
and
thank you very much.
Welcome back to
Well,
Spencer
thank you.
Chiropractic. It's always a pleasure to have you here and talk
Well, it's
to you
always
about...
a great educational experience to find out the different things that you can do, and have people ask me from time to time, can you recommend a good chiropractor? Well, of course I can. She helped me. What kind of problem are you having? Doesn't matter. She can hook you up. And especially if somebody comes up and says, you're a pain in the butt, you can, if you really are, then maybe you can get some help here too.
Well, that's one of the things we're going to be talking about today, are pains in the butt, and pains in the lower back, and pains down the leg, and how we can help people with that. Lower back pain is the #1 reason why a person would come in and see me. Many times a person would injure their lower back just doing too much work in the yard, or doing an activity, lifting something that's too heavy for them, overstepping their limits is what I like to call it.
Even lifting grandkids.
Yeah, lifting the grandkids, and or a repetitive type work that's just too hard for you physically, that you're not keeping up with the challenge of.
Right.
And so at Spencer Chiropractic, we begin with a thorough history of you and an examination to see what's causing your problem and how we can help you naturally without drugs or surgery. Some of the places that a person would have pain that comes in with lower back issues are highlighted here on this specific nerve chart. These are pain-generating nerves that come through here. The nerves that come out of the lower back and in the lower tailbone area come together and form that sciatic nerve, which comes out and goes into the buttock. Many people are familiar with sciatic nerve pain. And there's so many different causes of leg pain into the body. Maybe your muscles are over tightening as a result of imbalance between your left and right sides. Many times we see the pelvis twist and rotate, and that can cause pain down the sides of the legs, the front of the legs, the back of the legs, symptoms all the way into the feet. And many times we see people come in, they're limping around, they're on a cane, their quality of life has decreased, and they've just been putting up with the pain or taking over-the-counter medications. Perhaps they've had injections in their back. One of the things that has just recently come into my awareness is that the injections that you have directly into the spine, the epidurals that a lot of times people are using for pain management, actually can decrease your bone density and put you at a further risk for fracture in your life. And if you can do things in a non-invasive way, many times people are looking for that. Or perhaps they've had an adverse reaction to a medication or to a shot. Chiropractic helps people with very severe back problems, degenerative joint disease, herniated disc disease, spinal stenosis, facet joint problems, and things of that nature. Get a better quality of life without drugs or surgery. Many people now are on pain management.
Yes.
They get on pain management. And perhaps they've gone along on that for a while, and perhaps the medications that they're taking are really interfering in the quality of their life. They don't have the energy that they used to because of the side effects of the medication, and they're wanting to reduce medication. Chiropractic can be a fantastic form of pain management for a patient who has lower back. And this is what I hear a lot of times from patients. I have arthritis or degenerative joint disease, and there's no way that's going to go away. Well, that's true. It doesn't matter what anybody does. We're not going to be able to make your back look like a person who doesn't have that.
Right.
But would you like your quality of life now to be better, even though you have those problems, without drugs and surgery?
Well, yeah.
Yeah, of course you would. And it's just like a diabetic, that they have diabetes, right? Nothing's going to change that, right? But if they eat or do something that they should not do, their blood sugar is going to go up. And if they maintain their diet, their exercise and things like that, their blood sugar goes down. Well, you have some control over your problems in your back too. if you start getting those joints moving better through the appropriate chiropractic care, it stops putting so much pressure on those pain-generating nerves that are coming out and going down into these areas. And quality of life, even though you have a degenerative problem or an advanced problem, can be improved. And, you know, I hear from people too, once you go to a chiropractor, you always have to go. Have you heard that?
I've heard that.
Yeah.
Once you go, you got to go for the rest of your life.
Yeah, and that's just simply not true. But
Well, let me ask you this. I came and saw you last year after my accident. Came for what, 6 weeks? Have you seen me since?
only in here, Jeff.
Only to come say hello.
Only to come film these segments. That's right. So, in chronic pain management cases, the patient may want to come, just as if they had, you know, say you had a debilitating heart condition. You wouldn't want to just stop taking your medicine,
No,
right?
not at all.
And if you're a diabetic, you just wouldn't want to just throw your sugar medicine out. You want to manage your condition. And with people who have debilitating conditions, they may choose to continue chiropractic care to manage those conditions. Some people choose to continue on to have because they want wellness care. They want enhanced performance. They want to feel good. They want their spine to be in line. They want to avoid future problems like their parents are having now and take better care of their spine, just like people weren't taught years ago to take care of their teeth, you know, and they see, you know, the effects of that now. People are being taught now to be more proactive in taking care of every part of their body, their teeth, their spine, their eyes, you know, everything as a part of wellness. And so, but, you know, you're not locked into any contract with us. You come here and you know, we outline a program of care for you, based on what your needs are. And the patient either accepts it or they don't. And then they continue on with maintenance or they don't. But I tell you what, after being in practice for as long as I have, which I believe is 17 years this year. No, it'll be 18 years this year.
Wow.
I see that the patients who stick with the maintenance care, who have the problem, the chronic condition, who come in for periodic checkups, have a better quality of life and less deterioration going on in this area, in spite of having spinal stenosis, arthritis, degenerative joint. Yeah, and in spite of those problems that they thought that chiropractic couldn't help them with, because they are permanent problems, but the symptoms can still be managed and reduced.
And that's one of the most important things, is managing those symptoms. Dr. Spencer, is always a pleasure to come see you. Always an educational to come see you as well. If you're having some issues with lower extremities, your lower back, anything like that, legs, nerves and everything, could be definitely a skeletal problem, and they can help you out here at Spencer Chiropractic in Gulf Forward.